It's my pleasure today to introduce Dr. Itzhak Brook, who is an adjunct professor of pediatrics at Georgetown University in Washington. He earned his medical degree and completed his residency at Hebrew University, the Hadassah School of Medicine in Jerusalem, Israel, and obtained his master's degree in pediatrics from the University of Tel Aviv in Israel. Subsequently, he completed a fellowship in adult and pediatric infectious diseases at the University of California, Los Angeles, and he served in the medical corps of the U.S. Navy for 27 years. Dr. Brook is the past chairman of the Anti-Infective Drug Advisory Committee of the FDA. He's done extensive research on anaerobic and respiratory tract infections, anthrax, and infections following the exposure to ionizing radiation. He's the author of 6 medical textbooks, 138 book chapters, and over 500 scientific publications. Sounds to me like you're kind of a genius sitting over there, but okay. He's an editor, associate editor, and member of the editorial board of several medical journals and the Head and Neck Cancer Alliance. Dr. Brook was diagnosed with throat cancer in 2006. 2 years later, he had his larynx removed and currently speaks with a tracheoesophageal prosthesis. Dr. Brook is the recipient of the 2012 J. Conley Medical Ethics Award by the American Academy of Otolaryngology Head and Neck Surgery. He is the author of the books My Voice, A Physician's Personal Experience with Throat Cancer, and In the Sands of Sinai, A Physician's Account of the Yom Kippur War. With that, I'd like to introduce Dr. Brook. Thank you.
Good morning to you. I'm honored to be here today and speak to you about my experiences as a patient with head and neck cancer. It's a very unique experience to a physician after practicing medicine for almost 50 years to suddenly reverse sides and become a patient. Perhaps you can make the voice a little louder. I was fortunate that throughout my life I really didn't experience serious illness, and suddenly losing my voice and losing my health and came as a surprise, but in many ways it opened to me avenues and areas I've never experienced before, and this is really what I want to share with you today, especially since you are very early in your medical education. I think it would be eye-opener to you to see through my eyes how it really feels to be a patient. It's a completely different story than you get from books or from caring for patients as a clinician. A few words about my voice. I had laryngectomy, and I don't have, of course, the larynx and vocal cord, but fortunately, I still have a voice, and that's because I have a voice prosthesis, a little plastic tube that connects my trachea to my esophagus, and I have a valve here that automatically feels when I want to speak the pressure, and it directs the air. It closes a valve and directs the air from the trachea to the esophagus, and actually the vibration that are created by the movement it's the same voice, same accent, but it's a very weak one that needs amplification. First of all, head and neck cancer is a very unique type of cancer, and that's because it's a type of cancer that affects all modalities of life. It affects the ability to communicate, to eat, to speak and interact socially, and above all, it's usually something you cannot hide. There are many people who have cancer, but nobody knows about it. We head and neck cancer survivors bear it on our head and neck and the way we speak and appear. And there is a silver lining to it, which is in a way, by keeping on living, doing, acting, we actually can show others that life can still go on despite adversity. Actually, there is a lot of similarities between war and serious illness, including cancer. It's actually something that I learned after getting sick. You heard that I had experiences in both the Israeli military and the United States Navy in wars. I served in 4 wars, 2 in Israel, as a medic in the 6-Day War, and a physician in the Yom Kippur War, and the Gulf War, and the Iraq War, in the US Navy. So war and serious illness share the same things. You survive, you struggle to survive in both. There is uncertainty of the future in both. You don't know how your cancer will lead you to, and you don't know if you'll make it through any war. So the lack of control of the destiny is the similar feature, which is very, very frustrating to both soldiers and patients. They deal with fear, anxiety, and there's both PTSD in both conditions. Only recently did we realize that many patients that survive serious illness, ICU, intervention, do have PTSD. But there is one benefit, if there is any, to both of them, that when you survive them, you have greater appreciation for life. And that's a very important lesson or consequence of going through those 2 terrible experiences. What I want to talk to you about today is, first of all, share with you what it feels to go through the diagnosis and treatment of cancer. What patients go through as far as radiation, surgery, the reality of the frequency and seriousness of medical errors, the importance of patient advocacy to prevent them, and what it is like living with cancer and laryngectomy, what kind of psychological issues patient may deal, and what can we do to improve the care. A lot of what I'm going to say is what I felt, but many, many patients feel the same. So when I, rather than say you, I'll say I. When I was diagnosed and learned about having to deal with cancer. It was a major crisis in my life. For some strange reason, I always felt lucky, able to survive difficult situation, being healthy. And then suddenly, out of the blue, a pathology report tells you you have squamous cell carcinoma. It's very, very scary. Suddenly, everything shattered. I did not feel invincible anymore, and I had to deal with potential mortality, uncertainty about what the future on me and my family will be, and a lot of anxiety of not knowing what the future will be and what kind of treatment I had to choose as far as where it will lead me to, what their doctors to choose to take care of me. Simple things that became very, very complicated. Should I tell others about it? Will I be discriminated? Will my friends shy away from me, knowing that I may not be there next year? It influences relationship at work with my family and friends. And basically I started to become dependent on others. The more therapy and treatment I needed. Treatment was pretty gruesome. Radiation in my chemotherapy and surgery. In all of those have severe, difficult side effect. Radiation, and it's very ironic. When I was in the military, a large portion of the research I did was on radiation effect on a human being and how to prevent infections post-radiation. I routinely have my technicians irradiate animals and watch to see what infection they would get and how we can save them. And suddenly, I became one of those victims of radiation myself, getting radiation and experiencing what it really feels like. And the acute signs of radiation, short-term are listed here. They basically, because the radiation was directed at the oral cavity and neck, it causes mucosal inflammation, altered taste, saliva is reduced, you get the skin burn, and you generally become very weak the longer there is the radiation. But ironically, radiation is a gift that keeps on giving. Once you get a certain dose of radiation, it is never going to, the effects are never going to leave you. And you can read and see those side effects. But the most significant one relate to a low thyroid function, which is relatively easy to correct. Dental issues because saliva is reduced. Damage to the muscles and fibers of the neck that causes ongoing fibrosis. Damage to the carotid artery potentially that can cause changes in blood pressure. It can cause damage to the supply to the brain and also damage to the spine at the cervical level, and of course second malignancies. All those issues need to be dealt with, and so is definitely a problem that doesn't go away, even when cancer goes away. One of the issues that I was shocked to learn about were medical errors. I have been a physician for many years. When I began until I became a patient in the ward, being treated for a serious illness, and I realized within a day or two that being a patient in the hospital is a great liability. I realized that mistakes are made on a daily basis by well-meaning physicians, nurses, clinicians. They occur at all levels of care. As a patient, I was very reluctant to complain. I appreciated the hard work physicians were doing, nurses were doing, and I wasn't going to become a complainer. I also worried that if I start to complain, I will be looked upon as a troublemaker, and the physicians, nurses will shy away from me, and that was inhibiting me from complaining. Imagine what a layperson feels when they see a doctor or nurse. They very rarely challenge them. They look up to us as gods, as people who know everything. But you learn over time that there is so much unknown, and medicine is not only a science, it's also an art that is never perfect. There is no one way of doing things. There are many ways. There is debate about almost every issue, but the patient don't know that, and they don't challenge us. They are afraid to correct us. It's only after I realized that if I don't start advocating, complaining when I see an error, I will not get out of the hospital at all, or I may get out with a problem that will not go away. Especially as somebody who couldn't speak, complaining and challenging and correcting becomes very, very difficult. There is a lot of literature showing that the mistakes are very, very prevalent. About a third of the patients experience a serious mistake that affects their life to some degree. In almost every illness, it increases morbidity, mortality, prolonged cost and hospitalization is increased, and it may lead to malpractice. It builds up a distrust in the patient. In my case, I felt like anxious all the time because I was watching what was done to me at all times of the day and night to catch and prevent mistakes. And I'm not exaggerating if I tell you that I saw between 2 to 3 mistakes a day. Some of them were very minor, but with potential consequences. Some were pretty major that could have affected my life. Let me start with them physicians' mistake that happened in my care. My physicians saw me once a month after the cancer was diagnosed. They treated me initially Valsalva procedure means that you swallow air and breathe against a closed mouth. When they put an endoscope in your esophagus, this opens up an anatomical location called the piriform sinus. Well, I had a recurrence of the cancer in the piriform sinus that was missed for 6 months until an astute first-year resident that did it according to the book asked me to do a Valsalva procedure, and he immediately observed a large recurrence of about an inch big malignancy. Nobody did it before. I didn't know you need to do it. CT, MRI, PET scan were all negative. But direct visualization showed it. As medical student, remember, with all the technology we have today, there's no substitute to good physical examination. My physicians were so sure that there is no recurrence because all the other tests were negative. That is a very, very important lesson for everyone. The other important lesson is that to do things, you are only those that you know to do them well. My physicians wanted to help me very much. They were very kind and caring, but they exceeded their knowledge in trying to remove the cancer using endoscopy and laser. It's a procedure they have only done once before, and they still assured me they can do it. My surgeon told me in surgery, you see one, you do one, you teach one. That's false. You see 200, you do 100, and then you teach one. I think there is a tendency in physicians to help their patient. We all are going to medicine because we want to help our patient. But sometimes admitting that this is beyond our knowledge, beyond our expertise, is okay. There's nothing demeaning about it. It shows confidence and honesty. And that's something that in my case led to the fact that when my surgeon actually tried to remove the cancer using laser and endoscopy, he just did not remove the cancer. He removed the scar tissue that looked suspicious. The cancer was at 2 inches below, and because he has not done it more than once before, he didn't remove it, which had a lot of consequences on my health, having to go 2 more surgeries, and eventually there was so much edema and swelling. The only other alternative was laryngectomy. So, know your limits, and when you're dealing with something that is beyond them, refer to others. There is a tendency also in with me, explaining what to expect. And so when they came with a food of tray a week after the surgery, I immediately suspected something was wrong. Nurses' mistakes are very, very common. Nurses are overworked, strained, and they don't always have the time to do the work they should do it or do it correctly. Calling the nurse to come and take care of me didn't always work. One of the scariest experiences happened to me in the surgical ICU a day after my laryngectomy. I was lying in bed, connected to 8 different tubes, catheters, IVs, monitors, breathing in my stomach, unable to do anything. But suddenly, I felt mucus plug in my trachea. I couldn't breathe. I was struggling for air. In a good ICU, there should be a nurse for each patient. In the hospital I was hospitalized in New York, they were trying to cut down expenses, and one nurse was on 3 patients. The nurse wasn't there, and I was struggling for air. Well, I decided to alarm them by taking off my oxygen monitor, taking off the EKG monitors. There was a flat line in the EKG. The bell was ringing. Nobody came, and I was about 10 feet away from the nursing station. It was morning and there was a lot going on. Perhaps there was somebody else sick. Finally, my wife just happened to walk in the morning, miraculously, and she called the nurses who came to suction me right away. Those 5 to 6 minutes of struggling for air looked for me to be like hours. And that is something that can happen in the best places. What happened is that the call button for the nurse that was supposed to be stuck to the bed fell to the floor, and there was no way I could get help. There are many, many issues listed here that I saw all the time. Not washing hands before touching the patient, me. Not using gloves. Not covering the thermometer with plastic. Using inappropriate cuff to measure blood pressure with generated high or low blood pressure. Administering the incorrect doses of medication. That was very scary too. I have to share this with you. I told my physician that I have a migraine headache, and he asked me, what do you usually take? I told him I take Imitrex, 25 milligram. He said, sure, we'll give it to you. After 10 minutes, a nurse appeared with 3 syringes. Fortunately, I was before my laryngectomy, so I could still speak, and I asked her, why do you have 3 syringes? Oh, she said, well, here are 3 vials. Each of them had 8 milligram of Imitrex. Your doctor wrote 24 milligram of Imitrex. Here they are. I said, no, 25 by mouth, not by injection. If you remember pharmacology, Imitrex can cause severe tachycardia, and even in high dose can cause a ventricular fibrillation. Fortunately, I caught the mistake of giving me for the right dose in the wrong route, which could be devastating. Now, being a physician was an advantage, but what about all those people who are not able to do that and correct the mistakes? Here are some more. Giving a medication that are diluted incorrectly, not suctioning the patient in the right way, not rinsing the tracheostomy tube correctly, which can cause burn and trauma. Preventing the errors is very, very important. It can and should be done. It's important to have good training, to adhere to standards, employ people who are well trained, and when there is an error, correct it, admit it, learn from it. The most important way to prevent medical errors is following algorithms that put all the stages to 1 to 2 to 3 and check it out that you have not forgotten it. And talk about mistakes. Educate the patient and their caregivers what to expect so they can correct anything, and have somebody with the patient as an advocate who can catch the mistakes. Often patients are so overwhelmed when they deal with a serious illness that they lose their ability to observe and correct. So having somebody with them who is able to be more calm and objective helps prevent. And when it happens, admit them. This is the best way of preventing them and preventing malpractice and restoring trust in the patient so that he or she won't be always anxious and waiting, fearing the next mistake. Patients should be encouraged to help prevent mistakes. Medical history, giving it correctly, is very important. Patients should do it. They should also be encouraged to observe us and question us, and don't easily give in or up. If you have a sample, a problem that needs to be challenged, and don't think of us as gods, as people who are infallible. We are human. We make mistakes. And I would encourage you, patients, to do it so that they will challenge you. Also, getting a second opinion is very crucial. It's something we should encourage them to do. Looking for people who are good in their field. And what I'm trying to tell my patients is not to confuse friendliness with expertise. We should all to shield them if they can actually deal with it correctly. When there is advocacy by the patient or the family, mistakes are reduced. If the patient read and learn and ask, they'll become an expert, and they can, by educating their clinicians, help prevent mistakes. I met as a patient several types of doctors. I met the optimists who see their cup half full, others see it as half empty. And one important thing I learned is the importance of a hug. H-U-G. I can't pronounce H very well. Hug is something very, very important. It doesn't have to be a physical hug. It can be an emotional hug. And let me share with you a short video from a documentary where I spoke about the power of a hug and how it affected me and made my treatment much better and helpful. Who specializes in infectious disease, and I work at Georgetown. My name is Itzhak Brook, and I'm a pediatrician who specializes in infectious disease, and I work at Georgetown Medical Center. I was diagnosed with cancer 8 years ago, and my first experience in being hugged was when I learned about the diagnosis. I learned it from the Department of Pathology. Myself, I went to retrieve my lab results, as people become more specialized and subspecialized, they limit themselves to the area of the body they are expert in. We need to be able to examine the whole patient. When I asked my otolaryngologist to listen to my lungs, he told me I don't even carry a stethoscope any longer. To his credit, he admitted it and had an internist come and examine me. But there are many specialists who keep looking at the whole patient, physically and mentally. It's important to understand the strain a patient goes through when they have a serious illness, and be patient, sensitive, and allow as much time as needed. It is very difficult today with a lot of pressure to see patients that physicians don't have the time they wish they had. But we need to find a balance that will allow that communication to go on and the patient not to feel that they're being rushed. And that's a very important lesson for us to improve our care. When I got out of surgery, I was suddenly overwhelmed with a lot of issues I needed to deal with. Am I cured? Will it come back? I also had to make sure that I'm being followed up and learning also the hard way that there are limitations to all the new sophisticated technologies that is available. And in many occasions, with a serious illness, they concentrate on their major diagnosis. One important thing is to not forget that in addition to the cancer or other serious issue, there are other body systems that need to be taken care of. The lungs, the heart, the kidneys, the skin, the teeth. All those things are often neglected when the major life-threatening issue becomes center stage. Preventive care is very essential to prevent problems in other body systems, including dental care, especially in head and neck cancer, continuing follow-up, vaccination, adequate nutrition, especially in cases of head and neck cancer. And those are some of the problems that elderly people need to concentrate beyond dealing with their major problem like diabetes, hypertension, and neurological issues. Psychological issues are very, very critical in all people, especially in cancer survivors. Head and neck cancer patient, are they suffering a lot from depression? I've seen people who committed suicide actively or passively by not taking care of themselves. It's the number 2 cause of suicide in cancer patients. And that's probably because of the difficulties it poses. Causes isolation, changes in appearance and body image and sexuality. or people who are in sales are especially affected. I think I'm fortunate that in my profession I still can keep going on, but many other professions do not have the ability to deal with that issue. Depression has to be dealt with in patients with serious illness, including cancer. Those are some of the things that are here, taking an active role, determining to not give up or give in. Very important. There is psychiatrists and medications available, support group in institutions, by family, and other professionals. I can tell you that I had to deal with my own depression. Once I learned I had the diagnosis in a paradoxical way, it was really a helpful reaction because I said, okay, so I have cancer. I don't care then. I die. I would die. Who cares? It worked for me for 2 days. And then I said, wait a minute. There's something wrong about it. I cannot give up so quickly. And what entered my mind was my family and children. I said to myself, one day my children will be older. They too may have issues that may threaten their life. Is this the message I would like to leave them with? That there is difficulty and problem. You give up, you give in. And that thought pushed me not to give in to cancer and depression. Fight it. Get the treatment I needed medically and psychologically by going to counseling, by going to groups of laryngectomees, and by doing what I'm doing now, speaking, teaching, writing about it. And every patient should find their own way of renewing the spirit, of finding purposeful thing in their life, of turning adversity into advantage. And those are the issues that can help them cope with things. Life as a laryngectomy has a few benefits. Some of them are funny, like not snoring anymore, having a great excuse not to wear a tie, which I always hated, not smelling bad smells. I can always avoid cigarette smokes by doing this and still being able to breathe and speak. I have no colds anymore because the respiratory virus need to get to the nose, which they don't. I breathe from here. And I can be resuscitated more easily if they do it the right way, which is another issue. They often, when I needed to have procedure or go to the ER, they gave me oxygen here, which is another problem to be dealt with. But using the setback as an advantage is something that can help people get back on their feet. I wrote a couple of books that relate to laryngectomy. I gave out my book as an ebook, and I hope that you all got copies of it. But it's available for free also available free on the Head and Neck Cancer Academy. And I think that reading it will give you more details and more insight to what it feels to be a patient. I like to conclude by sharing with you another short video that will tell you a little bit about my life now and how I deal with cancer.
Find more darkly pigmented
Doctors are used to being the ones giving the advice, not the ones receiving it. But there was a physician at Georgetown University Hospital who has had to deal. His message is heard. For someone who speaks in a whisper,
Hi, good morning.
Itzhak Brook has a very big voice. Brook was born in Israel. He served in the Israeli army during the Yom Kippur War in the 70s. But he says the cancer that took his voice was his toughest opponent ever.
It's more difficult than even being in a war. Because in the war you are with friends. You can speak. You can share. You can see the danger. But this is so out of control. Because cancer has its own life. And its own way of acting.
Brook retired as a doctor in the U.S. Navy and is a pediatrician at Georgetown with a specialty in infectious disease. He had spent years working in hospitals, but not much time in the hospital until one day in 2006 when his throat began to hurt.
I felt the soreness in my throat. And it didn't go away after about 2 or 3 weeks.
A biopsy revealed cancer.
I was shaken. I couldn't believe it that I had cancer. But there it was. I needed to deal with it.
He did, but a year and a half later, the cancer had returned. And this time, doctors told him he had to make a choice, lose his larynx or run a great risk of cancer costing him his life. It's a choice he'd actually thought about as a healthy young man studying to become a doctor.
I was really astounded and shocked. And I said to myself, if I had to make a choice like this, to live without a voice, I would rather die. But when I had to choose for myself, when I had to make a choice, it was no-brainer, of course.
Brook now speaks with help from a reconstructed airway and a prosthetic device.
My voice now is the same as it was before. Even my foreign accent, my Israeli accent is still there. It's just whispery and weak.
While there have been times when he wanted to give up, he says he kept going for a chance to see his grandchildren and a chance to inspire his children.
I knew that one day they may too have to deal with adversity. And I wanted them to remember that their father didn't give up. He still kept trying to make something out of his life.
He has certainly done that. Do you think you're a better doctor now?
I'm sure I am.
So he became a better doctor, but for Brook, that wasn't enough. He wanted other physicians to understand not just what it means to be a doctor, but also how it feels to be a patient.
As a patient, I felt how difficult it was on the other side of the stethoscope. When doctors are rushed and busy, when nurses have so many other patients, they don't have time to you and to take care of what you need.
Esophagus sits behind the...
Dr. Bruce Davidson is the chair of the Department of Otolaryngology at Georgetown and a head and neck surgeon.
Stick your tongue out to the left. Right.
As a resident, Davidson used to read journal articles written by Brook. Now he is Brook's doctor and is still learning from him.
There is certainly a perspective that he brings that nobody else can really bring to the table, even if you're the treating physician of hundreds of patients. Having seen things from his perspective, I think educates all of us.
Ironically, this man whose voice was taken away is educating by talking.
Anything I've been on,
With the help of a microphone, Brook lectures to doctors and medical students around the country. He's even written a book urging communication and compassion.
It's very, very important to be compassionate and humane and patient and listen. Listen to the patient. Understand what the patient is thinking and feeling. How terrifying it is to be in a big place with tubes and catheters and IVs and machines around you. And your life is at the hand of other people. And there's so much unknown.
He takes extra time to show patients not just his knowledge, but also his heart.
Let me also examine your teddy bear. He's okay.
He remembers being the one in that bed.
There was one doctor who would hug me every time he saw me. And his hug meant more than 1,000 words that he told me.
A powerful message, even when spoken in a whisper.
So it doesn't hurt so much. It's good.
In Washington, Beth Parker, Fox 5 News.
So many profound messages there. To read Dr.
Any questions? Well, I hope